Cold Injuries, presented by the Mount Baker and Chief of Seattle Councils for the Winter Skills Adventure Program. No cold weather injury class is complete without a discussion of the mechanisms of heat loss and heat gain. Understanding these concepts will help you plan for, avoid, and treat cold weather injuries. There are several mechanisms of heat loss. Your body loses heat through radiation of electromagnetic radiation. This becomes more apparent as the temperature drops below 68 degrees Fahrenheit. Some of this heat can actually be reflected back with a tent wall or mylar blanket. Convection is a transfer of heat via movement of air, wind, and water. Conduction is a loss of heat via direct contact with the ground, water, or fuel such as white gas. Laying on bare ground can conduct a significant amount of heat from your body into the ground. Water conducts heat about 25 times faster than air. Metal and supercooled liquid fuels can cause immediate contact frostbite. Evaporation of any moisture on your skin or clothing can result in significant loss of heat. So it's really important that you stay dry. With every breath you take, you exhale warm, moist air. In this process, with every breath in the cold environment, you're losing a little bit of fluid and a little bit of heat. There are several sources of heat gain. There's non-exercise activity thermogenesis, which includes your basal metabolic rate, shivering, which can produce a considerable amount of heat, non-shivering thermogenesis, which is heat created by brown adipose tissue, diet-induced thermogenesis, which is the heat created from digesting food. There's also exercise-associated thermogenesis. This is the heat that you build up when you're snowshoeing or working building your shelters. And of course, there are external heat sources such as heat pads, fires, or wood stoves. Staying warm and avoiding a cold injury is all about balancing out heat gain with heat loss. So here we have a hiker who's walking around in the snow. He's creating a little bit of heat just from his basic metabolism. He's creating a lot of heat from exercise and walking. And he might be getting a little bit of heat from the sun. Now, as long as that's greater than the loss from the cold air, conduction from the ground, wind, and any wetness that he may have, then he's going to do fine. Now, after our hiker stops exercising, he's going to lose that source of heat, and things are going to start to cool down. If heat loss from cold air, conduction, wind, and wetness are greater than the heat gain created by this hiker, his body temperature is going to drop. If it gets cold enough, our hiker will start shivering, which will produce some heat. Hopefully the shivering is enough to bring up the hiker's body temperature to a safe level. A better method of keeping warm compared to shivering is by conserving the heat that you already have. And this can be done by putting on layers of insulation, which will help trap the heat that you have around your body and to protect you from all the other elements of heat loss. Daytime temperatures can drop as much as 50 degrees at night in the high desert. This type of temperature drop can be very dangerous. At night, everything is colder. The air is colder, the ground is colder, and there's often more wind. And these compounding factors can cause significant life-threatening heat loss. Shivering can help warm up the body, but it often can't be sustained for long periods of time or after someone has become completely exhausted. Your body posture does have an impact on how much heat is lost through surface area, so rolling up in a ball can be somewhat helpful. It is important to note that of all the different forms of heat loss, heat conduction is usually the least concerning, and the reason for that is usually only a small surface area is in contact with the ground, your feet, and usually your feet are well insulated from the ground with nice socks and nice insulated boots. Now this changes when you sit down or lie down on the ground, where more surface area and less insulated surface areas are in contact with the ground. Because of this, it is really important that if you're going to spend any time in contact with the ground, that you insulate yourself with an insulating pad, pine boughs, or something else that separates you from the cold ground. Wind can also really pick up at night. and really make things really chilly. Now, seeking cover or making cover, such as with a snow wall, is going to help reduce the amount of heat that's lost through wind conduction. This can be significant. Of all the different causes of heat loss, the one of greatest concern are those that relate to you getting wet. And this is particularly true in the Pacific Northwest, where we get wet all the time. Getting wet in a cold environment can turn a really miserable cold experience into a potentially life-threatening one, which is why it's vital that we stay dry at all costs. Although it is possible to survive the night without a shelter, in a winter environment, it is very difficult and potentially deadly to try to survive the night without a shelter. In some parts of the world, fires and stoves are used to heat up shelters and decrease the risk of hypothermia. This trades the risks of hypothermia with those of carbon monoxide poisoning. In this part of the world, with the temperatures that we generally see, this practice is ill-advised and also banned by the BSA. Keeping your body temperature at a safe range is all about balancing out heat gain with heat loss. As long as you're producing more heat than you're losing, you're going to be fine. Frostbite, the injury of the ill-prepared. Skin freezes at 28 degrees Fahrenheit. This is important to know because it has to be colder than that for your skin to actually freeze. Particularly at risk is exposed skin, including your hands and feet, as well as your nose and ears, which may not be covered up. Frostbite can be numb or painful, red or white and gray with a waxy looking appearance, or black, or include blisters that are filled with clear fluid or red fluid. Your body is surrounded by warmed air. When the wind blows, it blows this warmed air away from your body. This hastens cooling increases your risk of getting frostbite. Here we have a wind chill chart. This demonstrates how wind affects the risk of frostbite. At 0 degrees Fahrenheit, with a wind speed of about 5 miles per hour, it takes about 30 minutes for skin to freeze according to this chart. Now, if we were to increase the wind speed by 20 degrees, then that drops the time to freeze to about 10 minutes. And according to this chart, as we drop the temperature, or if we increase the wind speed, then the risk of frostbite drastically increases. As far as treatment is concerned, prevention is far better than treatment with frostbite. This is a typically preventable disease and is often not improved by treatment. It is best to prevent it from happening in the first place. Covering exposed skin and keeping your core temperature up will help drastically in combating frostbite. Here's a little bit more on heat regulation. As your body cools, blood is directed from your skin to its core. There's a saying that pertains to frostbite. Blood equals heat. Dehydration means that you have less blood. Tight-fitting boots means you have less blood in your feet. And having less blood means that you have an increased risk of frostbite. Now, staying hydrated increases blood flow. Exercising increases blood flow. And windmilling, which is where you spin around your legs or arms in a circular motion, that increases blood flow to your fingers and your toes. Increased blood flow means a decreased risk of frostbite. So what happens if you end up with frostbite? Well, just imagine that your fingers are going to swell up like big sausages. So it's important that early on that you remove any jewelry, any wet clothing that's going to cause further cooling of your body and extremities, and then place dry dressings in between your fingers and your toes, because as things thaw, it's going to get really icky in those areas. And then you can elevate the extremity, your foot or your hand, to decrease some of the swelling in that area. After taking these initial steps, the next step is to evacuate the person to the hospital. There are a lot of things that might be attempted at a hospital to decrease the amount of damage or reverse some of the damage, which is time sensitive. In a remote or wilderness setting, evacuation may be delayed by hours, days, or even weeks. If evacuation is delayed greater than 2 hours, consider rewarming the area. Keep the victim warm. Then consider your options for rewarming. These include use of dry heat, which is difficult to regulate and not recommended, the use of the buddy system, where you put the affected area on the warm skin of a buddy, or the preferred method, which is to soak the affected area in warm water. You may not feel that you have a thermometer available to measure the exact temperature of water, but you do. It's called the 5-finger thermometer. Place your hand in the water that you're thinking about using for a warm soak. If it's then it's not warm enough for the person with the frozen tissue. If on the other hand you place your hand in the water and it's then it's too hot. Now if you place your hand in the water and it's then it's just right. There's a couple of important caveats for rewarming extremities. The person checking the temperature of the water should be the rescuer, someone with intact sensation that can tell the difference between hot and cold. A person with a frozen extremity is not going to be able to tell if it's too hot or if it's too cold. This water should be rechecked often, and you should make sure that the victim's hand or extremity isn't touching the side of the pot or the bottom of the pot. Rewarming is complete once tissue seems soft and pliable and is red or purple in appearance. This takes about half an hour. A couple of final notes on rewarming and frostbite. Do not rewarm the victim's feet if they will be evacuating by walking and have extensive frostbite on their feet. Also, do not rewarm a frostbitten area if refreezing is expected, as this will result in even more damage. Hypothermia is a potentially life-threatening condition and should be avoided at all costs. The definition of hypothermia is pretty basic. It's a condition when the body's temperature is below normal. Heat loss is greater than heat generation. This generally occurs in temperatures between 30 and 50 degrees Fahrenheit, but can occur in temperatures as high as 70 degrees, especially when you're wet or in water. Here's a popular hypothermia scale that might be used in a hospital. It relies on the use of body core temperature to determine what stage of hypothermia the victim is in. Let's talk about the different stages of hypothermia and what you may experience out in the field. This person does not have hypothermia. They're not shivering, they're functioning normally, they have a normal mental status, they're conscious, and they have signs of life. If you were able to measure their temperature, you'd see that it's in kind of a normal range. Now, it is important to note that core temperature is of limited value in the field. One, an oral temperature is more or less useless, and it is very difficult to get a core temperature. This usually requires undressing the patient and exposing him to the cold. Do not undress a victim to get a rectal temperature. It's of limited value and is only going to increase their risk of hypothermia. Here we have someone who's shivering. They're still functioning normally. They have a normal mental status. They're conscious and they have normal signs of life. This person does not have hypothermia. They're just cold stressed. They're cold. You should keep them warm so they don't get to the next stage, but they do not have hypothermia. Here we have a victim who is shivering, but they're also not functioning normally. Their brain is cooled to the point that they're irritable and confused. They have what we refer to as the umbles. They're fumbling, grumbling, mumbling, stumbling, and tumbling. They're no longer functioning normally. This person has mild hypothermia. Here we have someone with violent shivering, or their shivering has stopped altogether, which is very concerning. They weren't functioning normally, and they no longer have a normal mental status. They have worsening of the umbles, they're confused, movement is slow and uncoordinated, they have that drunken walk. Now, hypothermia and no shivering, this victim really needs an external heat source. This victim has moderate hypothermia. This victim is so cold that they're no longer conscious. This is really bad. Without advanced life support, this victim may not survive. They're also at high risk of developing a deadly heart arrhythmia, which can be triggered by you moving around too roughly. So it's really important that you handle them with care, keep them on their back, and get them to a hospital as soon as possible. This person has what we call severe hypothermia. Here we have a victim who is not only unconscious, but has no signs of life. It is really important to know that a victim may appear to be dead, but through extended resuscitation in the hospital, they may be able to recover. No victim is dead until they're warm and dead. This person has profound hypothermia. The treatment of hypothermia is pretty basic. Warm the victim, prevent further heat loss, and don't let them progress down the further stages of hypothermia. Cold stress. Reduce heat loss. Get them into dry clothes, maybe have them exercise a little bit, maybe have a high-calorie drink or food. Mild hypothermia. Have them lay down. High-calorie food or drink may be helpful, and evac them if they don't improve. Moderate hypothermia. Keep them horizontal. Food and drink isn't going to work because they're barely conscious, and then get them to a hospital as soon as you can. Severe hypothermia. There's not a whole lot you can do out in the field other than perform CPR as needed. This person needs to go to the hospital as soon as possible. Rewarming can be very challenging, especially in a wilderness environment. And the level of rewarming depends on the level of hypothermia that the victim is in. So mild hypothermia, passive rewarming with a nice warm blanket may be all that you need. With moderate hypothermia, they're probably going to need some sort of external heat source. And then with severe hypothermia, only specialized hospitals are really going to be able to adequately take care of these patients. One option for passive rewarming is the warm brew, ideally something warm and sweet. It provides water, which is needed because most people with hypothermia are probably partially dehydrated, and they need the water to digest the calories that they're intaking. And the calories in turn are going to power their shivering and their metabolism, which is going to help their body produce heat. Don't give hypothermic patients boiling hot water. They're just going to hurt themselves. Also, don't give fluids or foods to people who are unconscious or no longer completely alert. There's a real risk that they're going to choke on it. Options for active rewarming includes use of fires and heaters. This may seem ideal, but it is really difficult to regulate to keep, one, the victim warm enough, and two, prevent them from burning themselves. A hot bath or shower may seem like a good idea, but it can lead to circulatory collapse and is potentially lethal. Under no circumstances should you consider using a hot bath or shower for a hypothermic victim. One option for active rewarming that's available to people in the field is heating up water in water bottles, wrapping them in cloth, and then placing the water bottles and the victim inside what we call a hypothermia burrito. The burrito will help contain that heat and help rewarm that victim. To make a hypothermia burrito, place a large tarp on the ground, place one or more insulation pads on top of the tarp, place sleeping bags or other insulation on top of that, place the victim gently on top of that, and then cover them with other sleeping bags or other insulation, and then wrap them up in the tarp. Now that you have your victim all packaged up and protected from the environment, you're ready for your evac. Rule number one for evacuation. Once you start an evacuation for someone with hypothermia, follow through, even if the victim looks better. For hypothermia, frostbite, and most other wilderness injuries, prevention is better than the cure. Wear the correct clothing. Cotton is not the correct clothing. Dress in layers, ideally synthetic or wool. Always bring the right gear. Be ready to spend the unexpected night out, and always plan for the potential of bad weather. Stay hydrated and eat regularly. Staying dry is really important in the cold. Wear the proper clothing that's not going to soak up water. Avoid overheating and sweating. Avoid getting into water such as ponds, lakes, or mud puddles, and shake off any snow before entering a tent or cave. Keep an eye on your team. Watch for signs of cold injuries in others, and be ready to take care of them. Most importantly, stay warm, because you can't take care of your team if you become a victim. The Wilderness Medical Society publishes practice guidelines on hypothermia, frostbite, and several other cold-related injuries. We recommend you review these for more in-depth and comprehensive discussion on these topics. Of course, your council also has a wilderness first aid course. This is an excellent program and it covers these and many other topics. With that, stay safe, and I'll see you guys out on the mountain.